Hi, hopefully you can all hear me. My name is Arun Notani. I'm the GP partner at Premier Medical Centre. So far I can see that a few of you have kind of already joined us. Today we're very happy to be kind of offering this webinar to our patients. And very happy to have kind of one of the child pediatric specialists from the hospital, Tammy Benzikin, to join us to teach you on help teach you on some common childhood illnesses, and ensure that hopefully we upskill you and get you to learn something this evening, and hopefully allow you to manage and deal with some of these conditions that we see on a daily basis, so that you can manage your own children better. I think what we'll probably do is just give it just maybe a couple more minutes to see if anyone else joins. But in the meantime, what I'll start doing is just moving a little forward, just so that you guys can understand a little bit about what we're doing here. So before I do, I'm just gonna explain what we're doing, and then I'll introduce Tammy, who's already on the webinar, and I'll introduce her in a second. But what we want to do is try and educate you all in terms of how to manage your children better. Being a father myself, I think it's really important to understand when to worry and when not to, and when you can manage your children at home, and when we want you to see us. One of the things that we'd like you to do, if possible, there's a QR code and also a link on there, and if possible, we would really appreciate you using your phones, ideally, to scan the QR code. And it will open up with a short survey that we just want to do before the webinar, before it starts, so that we can understand exactly how you feel. And hopefully at the end of the webinar, we're going to do the same types of questions to allow you to then hopefully see that your knowledge has gone up and you feel a little bit more confident. So whilst I'm speaking, if you are able to use the QR code and just scan that with your phone, that would be really helpful for us. The objectives of the session. So the objective of the session mainly is going to be to try and give you an understanding of what's normal and what's abnormal, and when we want you to contact us, and what we might be able to do is hopefully give you some ability and confidence to manage your own children at home, rather than always rather than worrying about things that if we educate you, hopefully you can manage at home. We're going to have a slide at the end in terms of contacts, so some useful contacts for you. We're going to have a Q&A at the end of the session, so please, any questions that you have, there is a chat icon which you'll see on your screens. Please, any questions that you have throughout the webinar, please write them in the chat, and we're very happy to, at the end of the webinar, to go over those questions and take it back from there. On the last slide as well, we've got a similar webinar. We've got, I'm just saying that, I've got one of my daughters has just joined the call. So Kiara, I need you to. This is Kiara. I'm just doing a. Kiara.
I'm going to show you something on my phone.
Just to prove this is a live webinar and I'm doing it from home. There you go. And then at the end of it, we're going to also do a feedback questionnaire, just so that you can see, hopefully, and we can hopefully see that this kind of has been useful for you, and give us any feedback for the next time that we do this. Okay. And with that, I'm going to introduce you to Tammy, who is our child specialist down at the hospital, and she'll be able to explain a bit about herself.
So hi everyone, my name is Tammy. I'm one of the paediatric doctors at Northwick Park Hospital. I have particular interest in public health and parent education, and I've been working with Aaron at Premier Medical Centre for the last 6 months, doing clinic once a month. So I might have seen some of you and your children there. I've been working as a children's doctor for over 8 years now, and I work mainly in the UK, but I've also worked in some other countries as well. I'm not a parent myself like Aaron, but I too have 2 nieces who are lovely and very naughty at times, who are 4 years old and 9 months. You're still muted, Aaron.
This is, I'll get used to this. So some of you who are attending may already know me. I'm one of the lead partners at Premier Medical Centre. I've been a GP now for 13 years. We have GP trainees at the practice, so I teach other GPs in training to allow them to become fully qualified. I've also got an extra diploma in child health, and I think probably the thing that makes me most qualified to talk about this is being a father of 2 girls. So one of them is 19 months. The one that just popped into the screen, I'm not sure if you saw her, is 4 years old, and I think when you become a parent, you absolutely go through everything that you guys do, and it really does put a different light and a different spin on kind of managing children. So yes, I'm going to just move forward now. Next slide. There we go. So what we're going to hopefully do is go through some topics. So those topics are going to be common conditions. So we're going to go through fever and what to do with a child that has a fever, vomiting and diarrhea, crying, and also rashes. And really what we want you to know is how to know when your baby needs medical attention, and really trying to recognize kind of the normal versus the abnormal, and when really you should worry, and when you can manage them at home, and when you can have the confidence to do that. So from our perspectives, the objectives of the session are really to support you in recognizing and managing common childhood conditions, recognize what can be managed at home and when you need to seek for medical advice, and also where. So it may not always be down to coming to the practice. It may not always be going to a hospital, but we want to try and direct you to the most appropriate place, and then take it from there. Tammy, I'm going to pass over to you to go over the pyramid of illness.
Hi, thanks, Aaron. So this picture is really just to demonstrate to you that actually very, very few children get seriously ill and ill enough to need to come to hospital. So if we see almost 130 children, 100 of them can be treated at home and managed at home, 25 might need to go to the GP, and then maybe about 6 to 7 might need to go to hospital, to an outpatient clinics, and very rarely they need to come and stay in hospital. So I want to reassure you at the beginning, even though we might talk about some more scary conditions, most of the conditions that your children get and the illnesses they pick up are very mild, and hopefully they'll never need to come into hospital. Next slide, please. So we're going to start off talking about fevers and temperatures. And I think the most important thing here is to really understand what a temperature is. In adults, we classify a temperature as between kind of about 37.8. But in children, we say a temperature is when it's 38 degrees or higher. And fever isn't necessarily a bad thing. Fever is good in some ways for your children and their body, because it's the way they fight their immune system, or it's the way they activate their immune system to fight the illness. So what your body's doing is creating a hot enough temperature to kill the bacteria in the body that don't like to be at a higher heat. Next slide, please. And there's different ways to measure temperatures. So the way we would most commonly advocate or encourage you to do is to measure temperature under the armpit, like you can see in the middle picture. That's because that's the most accurate, especially in babies and younger children. You can also use a tympanic thermometer, so one that goes in your ear, And that's a bit better to be used in older children because little children and babies don't have very well developed ear canals, so it's a bit less accurate than the one under the arms. The ones on the forehead are the ones that I put a big cross over, and that's because that tends to be less accurate than the other two methods. So I would recommend using the underarm thermometer, which is just the same as the thermometer you use in your mouth. Next slide, please. So when should you see a doctor if your baby has a fever? So if you've got a young baby who is under 3 months old and they have a fever of 38 or higher, you should go to see a doctor, either your GP or go to A&E. And that's because in very young babies, they don't have the ability that we have if you have an infection to keep it contained in one place. So what I mean by that is if we have a skin infection, then that will stay in the skin. Whereas if you've got a very young baby, that's more likely to spread and they're more likely to become seriously ill. The one exception for this is after your baby's first vaccines, because that can cause them to have a fever, and that's quite normal in the first 24 hours after their vaccinations. If your child is older than 3 months and they've had their vaccinations and they're well with the fever, you can observe them at home and manage their temperature at home. And the most important thing is really to look at is your child well? And by that I mean, are they managing to drink? Are they alert and awake, or are they very sleepy and lethargic and you can't wake them up? When you give them Calpol and Nurofen, does the temperature come down, which is a good sign? And also, are they drinking enough and having normal wet nappies, which is also an encouraging sign. So I think if you know they're drinking, the temperature is coming down when you give them Calpol, and they're alert when the temperature comes down, they're a bit happier in themselves, then you can probably manage it at home. Next slide, please. So there's a few tips and tricks that we can give you about managing your child's fever. So importantly, Calpol and Nurofen, they're not just for pain, they also bring temperature down. But if your child does have a fever, they're most likely to be a bit uncomfortable. So you can give them Calpol and Nurofen. And if the temperature is really not coming down, you can give them at the same time because they work differently. You can give Calpol 4 times a day and Nurofen 3 times a day. And you should wait for at least 4 hours between each dose of Calpol, each dose of Nurofen. The other picture of the child drinking is just to make sure that your child stays really well hydrated. So encourage them to drink lots of fluids. And then the pictures with the crosses are to show you what not to do when your child has a fever. So make sure they're not wrapped up really warm, and you want to undress them. And even if you have a fan at home, you can put a fan on. And the picture at the top shows someone using a wet sponge on their child's forehead, which used to be very commonly used to bring down fevers, but actually now we know that doesn't work very well, and if anything, it can sometimes keep the fever high. And the important thing to remember is really when you should see a doctor. And my take-home points for this is if your child has had a fever for more than 5 days, if it's not coming down with Calpol and Nurofen, paracetamol and ibuprofen, if your baby or child isn't drinking or they're having less wet nappies, and if they're very sleepy and you can't wake them up. Next slide, please. So I just wanted to touch very briefly upon something called febrile convulsions or febrile seizures, which you may or may not have heard of. And these are really quite common in young children. So I just think you should be aware of them, but they're nothing to worry about, but they do look very scary and serious. There is a link to a video of what it looks like, which we'll send out afterwards for you to be able to watch if you like. If any of you have had children with a febrile seizure, you know how scary it is. And what will happen is that you'll see all their limbs, so their arms and legs shaking, sometimes their eyes will roll up, and sometimes they can be incontinent of urine, and their face may go a little bit blue or red. So it's terrifying to see. But most of them really aren't serious in the long run. So they tend to last less than 5 minutes. And it's just that some children are more prone to having seizures than other children when they have a temperature. And up to about 5% of children will have these, so 1 in 20. So it's just, I think, important to be aware of. If it does happen, if you can, try to time the seizure. You probably want to call an ambulance, especially the first time, because it is very scary to see. But if it's happened before and you know what it is, you can manage it at home. And if possible at all, and again, I'm sure this isn't what you'll be thinking about when it happens, is to try and film the seizure. So then when you see a doctor, we know what you're talking about and if it was a true febrile seizure. And then put them in the recovery position. So put them lying down on their side just until it stops, and make sure they're in a safe place with nothing hard or sharp around them that they can hurt themselves on. It can happen with any virus, so it doesn't have to be a bacterial illness. And as I said, it just happens to some children that they're more likely to have seizures than other children. It doesn't mean they're more likely to have epilepsy or other problems growing up. It's just one of those things that happens, but good to know about. Next slide, please, Aaron. So key messages for fever that I think would be good for you to try and remember are that most children, when they have a fever, it's caused by viruses, so they don't need antibiotics. Most fevers get better by themselves and maybe with just a bit of Calpol or Nurofen within 3 to 4 days. And you can manage them at home unless the points that we discussed, they seem to be very unwell. They're not having normal wet nappies. If their fever is going on for more than 5 days, if they have a rash that when you press it, and we'll talk more about this, doesn't go away. And if you're worried, ultimately, you know your child best. And if you're very worried about your child, we do take it very seriously. So if you are concerned, please see your doctor. Next slide, please.
Right, thanks, Tammy. What I'll do is talk about another common condition that we often see, especially as a GP, but I'm sure Tammy sees her fair share of this as well. And that's vomiting and diarrhea. So if I just take you through initially with babies, so a very common fact is that all babies will reflux. They will all bring up some milk. It's very, very common, and it can actually happen up to 80 times a day, and that is completely normal. Obviously, the amount can vary, and I think there are tips and tricks for us to look at and for you to be aware of, so that we are seeing you when we want to, and rather than just if a child is just bringing up a little bit of milk. So again, key things are that all babies reflux. It's very, very normal to bring up a little bit of milk. What is normal and what's abnormal? So often, I think the way to think about it is how much is coming up and the color, and also how is the child. So if you're looking at the vomit, it generally will be small amounts. They'll be more milky in nature, so more milky colored, kind of cream or white. It might have kind of partially digested milk, but it often happens, especially after feed. So they're feeding, they may not be unwell, but you bring up a little bit of milk after that. Overall, the child is very well. They're gaining weight, they have normal wet nappies, and generally in themselves, they are well. Here are some of the things that we want you to be more aware of and more be concerned about, and actually contact us. So the color of the vomit. So obviously, if it's a green type vomit, then obviously we're more concerned. If it's something called projectile vomiting, and this term is used quite often, but projectile vomiting for us is literally, as you can see in the picture, the vomit is coming out at a stream, and it's literally coming out like a jet of fluid. If there's any blood in the vomit, we obviously would like to know, and that's more of a seek medical attention the same day. If your child cannot keep any fluids down, so if they're vomiting and they're not able to keep any water down or milk or any sort of fluids, then that's a time to be more concerned, as well as if they're unwell, or if they're vomiting with a fever or are very sleepy or lethargic, and they're not able to actually kind of keep the head up, and they're much more drowsy. This is just trying to explain that the colors, the ones that we worry about. So the greens, the browns, the dark browns and greens are the things that we want to worry about. And hopefully that overall slide gives you a good idea of when not to worry and when more to be concerned, and contact us the same day and actually bring your child in. Vomiting. So tips and tricks. So especially for reflux, make sure you win the child, keep them upright after feeding. Often, most cots now have an ability for you to raise one side of the bed so that actually there's a little bit of a gradient and actually the head is higher than the feet. Try to feed the child smaller and more frequently, and simple things like Gaviscon can really help with these things. There are supplements that you can buy from over the counter if they are vomiting. So things like Diorolite or the ORS, things that we've mentioned in the slide there. The other thing to think about is also there's some home remedies that you can try. So if you have water and you're having a teaspoon of salt and 2 teaspoons of sugar, that's just as good as you going to a pharmacy and buying Diorolite or another oral rehydration sachet, and that can be very useful. So what we want to try and think about is fluids are absolutely important in children that are vomiting, and we want to try and make sure that they're well hydrated and they're passing wet nappies. Again, things to worry about if they're having green vomit or they're sleepy or unrousable, then definitely call 999. So now the other end, and diarrhea. And diarrhea, the commonest reason that we will see a child is something called viral gastroenteritis or a tummy bug. In adults, we might call it as food poisoning or just the same kind of gastroenteritis, just meaning that the tummy is inflamed based on a virus, and you might just get diarrhea. Here are the symptoms. So the symptoms might be that they're watery, the motions are looser than normal, your child might be going to the toilet more often, they may even have a slight fever. The key things is staying well hydrated. Again, food is really not important in the early stages. And the key thing is making sure they drink lots of fluids. Diorolite or the home remedies to get fluids into them is absolutely key. And kind of the way to think about it is whatever they're losing in terms of fluid, we want to replace. So we want to, if they're having lots and lots of diarrhea, we want to replace it with fluids. Seek medical advice when your child's unwell, if there's blood in the poo, or if the symptoms are going on longer than we would expect. So if they're persistent, if it's going on more than 2 to 3 days, we would want to know about it. Key messages for vomiting and diarrhea is reflux is very common in babies and all babies reflux. Diarrhea and vomiting doesn't normally need any treatment. They need supportive treatment. So that is fluid intake, which is extremely important. Manage them at home if the child is well. But if the child is sleepy and unrousable, then what we want to do is seek medical advice. And one of the key things is monitor the number of wet nappies that they're having. I'll hand over Tammy for crying.
Thanks, Aaron. And just to mention, if anyone does have any questions going along, you can put them in the chat and we'll try and answer them all at the end. So crying, next slide, please. So crying is very, very common. All babies cry and it is completely normal. There's lots of causes why your baby cries. If they're hungry, if they've got wet or dirty nappies, if they want attention. And it's important to know, so when your babies are first born, they seem nice and quiet and sleep a lot. And then from about 2 weeks old, they will cry a lot. And they tend to very conveniently cry in the afternoon and the evening and at nighttime when you're trying to get some rest. It's average for babies or some babies to cry up to 5 hours a day, and sometimes even more. There's some babies that can cry up to 9 hours a day, and that's found to be normal. We don't know why some babies cry more than others, but I think it's important to know that it is normal, and it's normally just your baby, and there's nothing that you've done wrong to make them cry. Only a very small proportions of babies that have prolonged crying, and by prolonged I mean more than 5 hours a day, will have a serious medical condition. And I think crying is important for your babies because it does help them to attach better to you as parents. So they know that when they cry, you'll pick them up, you'll comfort them, and then that forms the attachment links and bonds between you and your baby. So don't worry if your baby's crying. It's nothing that you've done right or wrong. It's just that some babies do cry more than others. Next slide, please. So when should you worry about crying? If you think your baby's cry is different to what their normal cry is, so sometimes people would describe it as very high pitched or they're very difficult to settle. If they look ill, so if your baby's crying is associated with them being unwell, with, for example, a fever, so a high temperature of 38 or more, or if they feel very cold to touch, especially their hands and their feet might be quite cold, they look much sleepy. If your baby's in pain and they're crying consistently, continuously, because you think there's something wrong with them. And again, so these are obviously when your child is unwell and they can have a seizure, as we spoke about, a febrile seizure, and they might cry. If you notice that when your baby's crying, they're struggling to breathe, or they go blue in the face or very pale. So really, these are all just signs that your child is unwell, and they might be crying as well as being unwell, trying to kind of signify that they're unwell. And finally, as we've mentioned already, if your child has a fever, and as we've said, if they're under 3 months and they have a fever of over 38, then you should seek medical advice. And if it's more than 38, but they're over 3 months and they look unwell, you should also seek medical advice. And finally, if they're crying and they have a non-blanching rash, so that's a rash which we'll talk about again more later, that when you press it doesn't go away. So tips and tricks and what you can do with a crying baby. So I think the most important thing to remember is it's not your fault. And I can't emphasize it enough that some babies do just cry and there's really nothing at all that will calm them down for some babies. But it can really affect parents, and I see lots of parents all the time that find it that they struggle to cope with their baby's crying because it is loud and continuous and you feel like you're doing something wrong. Which you're not. But if you do feel like you're struggling to cope with your baby crying, I think it's really important for you to get time to yourself, time to breathe, and to be able to calm down and get some space from your baby. And that's not a bad thing to do. So just make sure that your baby is somewhere safe. So in a cot, for example, with the sides up, and then just leave the room for 5 to 10 minutes to get some space and calm down. And just remember that having a baby that's crying is much better than having a baby that's very quiet or very ill, and all babies will outgrow their crying. So it might be there when they're younger, but as they get older, it will get better. And just for if you're worried that the crying's caused by them being unwell or they have a fever, then we'd always encourage you to speak to a doctor or a healthcare professional. So it might be your health visitor or your midwife, depending on how old your baby is. Next slide, please. So the key messages for crying. As I said, crying is obviously very common because all babies cry, some more than others. It's just important to go back to the basics, think about why your baby's crying. Is it because they're hungry, they've got a wet or dirty nappy, or is it because they're in pain or unwell? And if not, it's just about trying to soothe them and also making sure you stay calm and soothed. And always remember, it isn't your fault, and it can be extremely difficult to cope with a crying baby. There's so many resources out there, and we'll send you at the end of this webinar a list of resources, and some of them include places that you can go and get a bit of support. So there's lots of organizations, for example, one called Crisis, that's CRY-SIS, for parents with crying babies. So you're not alone if you've got a baby that cries more than others. And then if you are struggling or you feel that you're not coping with how much your baby's crying, just get help. Speak to anyone, your health visitor, your GP, and also make sure if you've got a partner or family member around that you take time to yourself so they can look after the baby when they're crying as well. Next slide, please. So I'll pass back to Aaron to talk a little bit more about rashes.
Thanks, Tammy. Okay, so we're just going to give you a really quick guide on rashes. It's something we see a lot, And actually, the vast majority of rashes that we see are nothing to be concerned about, and very, very common. But there are a couple that we do want you to be aware of, and actually make sure that you look out for them. So just to kind of give you a very brief overview in terms of rashes, and hopefully show you some pictures that will allow you to educate yourselves a little bit better. So the key things, skin rashes are very common in babies and children. The vast majority of them are harmless. Most of them will go away on their own. And many children develop rashes when they become unwell with a viral illness. And for us, we worry about the ones underneath the skin. And by that, I mean, if you rub your finger over the skin and you can feel them, the majority of them, we do not worry about. We worry about the ones that you can't feel. And actually, when you I'll explain this a bit later with a glass test, or even if you try and take away the rash by compressing the skin or pushing on the skin and it doesn't go, those are the ones that we specifically worry about. Excuse me. I'm going to take you through a few pictures that we see very commonly. So this one, very, very common. It's called erythema toxicum. We specifically see it, and we often may use the term baby acne, or even you might hear us say the term milk spots. About 50%, so 1 in 2 babies will have it. It can occur any time from a week to 6 weeks old. It's completely normal and settles without treatment within 1 to 2 weeks. But we see it very, very commonly, and actually it's extremely normal. And it's happened to both my children. And that's very reassuring. And all you just have to do is continue as you're doing. You don't need any treatment. You don't need to see a doctor. It will settle by itself. Very, very common. Nappy rash. So again, this is a very, very common one, and one that, again, as a parent, I've seen it lots. As a doctor, I've seen it lots. I think some of the key issues are, if you look at the slide, the image on the left. So the pictures show that you've got kind of a little bit of nappy rash, or a slight bit of nappy rash at the top, and then as you go down, it becomes more moderate to severe. So key things: use a mild wipe or a warm, wet washcloth to gently cleanse and clean the skin. We use water wipes, which are great for our kids, and would highly recommend them. But a clean washcloth can also be very, very, very good. The key thing is keep the area as dry and clean as you can, and often try and give them a bit of air. So allow your children's bottoms to have some air as much as you can. So often what I used when I was a parent was, after they had a wet or a dirty nappy, I'd try and leave the nappy off for a little bit of time, so that actually you can aerate the area and actually have more air to the area. But if you are using some sort of cream, and Sudocrem is a very common one that we recommend, you apply a thick layer of cream when you do a nappy change. Eczema. It's extremely common, and one of the commonest things that we see. The child on your left that you're seeing is actually extremely, extremely severe case of eczema, and that's not the commonest one that we will see. Again, you'll see sometimes on the skin and on the face. And actually, a really key thing that we want to point out to you is, if your child is only on milk, and it might be breast milk or formula, but they haven't started solids yet and they're having eczema, they may have something called a cow's milk protein allergy, and that's a time that you may want to see us. And that's something that we might refer you to the hospital to an allergy clinic to do some tests to make sure, or to the pediatric clinic, somewhere where Tammy might see them, so they can do some tests to see if they have the allergy. The commonest type of eczema that we see is inside what we call the flexor creases. So that's inside the elbows at the back of the knee. So where your elbow bends or your knee bends, that inside portion, it might be dry, red, itchy, and when you run your fingers over them, it's very, very dry compared to the soft skin that's normal. What we normally suggest is these are the things that you need to look out for. So it might be a dry, red, itchy rash. Creams are are the mainstay of treatment. And what we normally try and recommend is a good emollient. So that's a cream that we would use to manage this. I use Diprobase. So I myself have mild eczema, and so do my kids. And a really good one we recommend is Diprobase, but all of them, a lot of them that you can buy over the counter, E45, Diprobase, Cetraben. There's a few of them that are very good. Double base. There's a number of them, and I think the key thing is finding one that works well for your child. We can use steroids. Those are very safe in general when they're used when directed. And they can go from the mildest type of steroid, which is hydrocortisone, which again is very safe, to a stronger steroid when used as we recommend, can be very safe in children. So both of those treatments, the steroids, are things when the eczema is not settling with normal types of creams, so the Diprobases or other those. I normally recommend to all the patients that I see actually trying to understand eczema a little better, and this is a really good website that I recommend, eczema.org. It gives you lots of advice from a patient perspective and how to manage eczema and how to manage it better, and give you the education that you need to manage it more effectively. The next rash is something called a viral skin rash. Can happen very common with a virus. Again, it's like a bumpy rash on top. It feels, when you feel the skin, it feels a little bumpy, it's red. And I think a key thing is to watch out for those. I would always recommend, if you're not sure and if your child is unwell, or if you're not sure, please contact us, because obviously rashes can be quite concerning. This is another common one we see, is something called impetigo. It happens on the face. It has this classically what we call honey crusted lesion. It looks almost like someone stuck it onto their face, and for that you need antibiotics. Might be cream antibiotics or it might be liquid antibiotics, but that's generally how we would treat it. Scabies. Scabies it generally happens when children are a little older, but can happen with babies and also younger children. Very common rash, very itchy, normally can happen all over the body. They're raised areas on top of the skin, and it happens in multiple different places in the body. Can be very infectious. So actually, your child might have it, but you might have it as well. Often can be managed by the pharmacy by buying a treatment called permethrin over the counter. One of the key things are, because it's so infectious, that actually you will need to wash their bed sheets and clothes. And actually, there's lots of advice on the NHS website about what to do. This is something called an umbilical granuloma that you can see in babies, and actually it settles normally by itself without any treatment, but you can use some salt on it. But the idea is to keep it clean. If you are at all unsure, then please come and see us, and we'd be happy to look at it. A common one that we all know about and you should probably be familiar with is chickenpox. Again, it's another thing that can happen all over the body. The child might have a fever. It will look like there might be blisters with fluid in them on top of the skin. Again, it can be managed by the pharmacist. Calamine lotion is the one thing that we recommend, which again can be bought over the counter. And if your child does have a fever, then using paracetamol as you need. Another common one that we see is something called hand, foot and mouth, and classically it will be seen around the mouth or sometimes inside the mouth, on the feet and on the hands. It's caused by a virus, normally settles within 7 to 10 days. The child might have a mild fever, and usually you see the rash classically on those on the hands, feet, and the mouth together. This is the one that I was mentioning that I think is really important, and for everyone and for doctors that we're most worried about. It's the meningitis, and so meningitis is a bacterial infection of the lining of the brain. And when you might see a rash is when you have the child has is more unwell. And actually the rash that you see is underneath the skin. So if you put your finger on top of the skin, you won't be able to do it. And what you're seeing there is a glass test. So it's a common one you might see. It's when you rub the glass over it, and I'm not sure if you can see it fully on the picture, but actually the rash doesn't disappear. In a lot of the other rashes that you'll see, the rashes disappear. And this is one of the things that we worry about. I think this might be a good time to bring Tammy in to talk about meningitis, because actually it's such an important condition, and actually it's a life-threatening one, and it's one that we really want you to be aware of.
Aaron.
Tammy, do you want to add something?
So I think, as Aaron said, it can be very scary and very dangerous meningitis, but actually it's type of meningitis, especially the one that causes the rash with the glass test, is now very rare. So we don't see it, I mean, hardly ever. I think I've seen it twice or maybe 3 times in my life. And that's because we do vaccinate children now against the really dangerous types of meningitis caused by bacteria. So when they're in their first few months of life, they get vaccinated against meningitis B and C in their routine vaccination. So that's really important to remember. There are some other signs in children and babies that we worry about that can cause meningitis. Particularly if a child has a stiff neck, I would worry. And by stiff neck, I don't mean just a little bit stiff. I mean that they really hold it in a position and they can't move it. If they've got sensitivity to light, so if they're complaining that the light's hurting their eyes and they can't be outside and they want to be in a dark room. If they're vomiting, that can be a concern, along not just vomiting by itself, but vomiting along with all the other features that I mentioned. So having a fever, having a stiff neck, having light sensitivity. But I do think it's important to remember that meningitis is still, and especially bacterial meningitis, is still very rare. So it's important to be aware of, but also know it's very unlikely to happen, and at least not the very dangerous type now if your child is vaccinated. But if you're worried at all about this, there's lots of information on the Meningitis Trust website, and you can find some information there. And also, if you're worried, just contact your GP.
Thanks, Tammy. So key messages. So if it blanches, by that I mean if you compress it and it goes, usually don't worry. If it's on top of the skin, usually don't worry. If it's itchy, you can try an antihistamine, which you can buy over the counter, Piriton or cetirizine. If it's dry, try a moisturizer or an emollient or oil in babies. If it's painful, use painkillers. So paracetamol, ibuprofen. Definitely see your pharmacist, because they can often treat a number of things, and really try and know the signs for meningitis. Specifics to try, so for nappy rash, there's Sudocrem and Metanium. Chickenpox, calamine lotion. Eczema, emollients like Diprobase, and scabies, try permethrin. So we've touched on kind of quite a few different things there, and I'm just going to touch on kind of where to get advice and how to get it. So, you know, one of the key things that we want to try and get you to understand is where to go for various different things. And sometimes it might be the hospital, sometimes it might be the GP, but often for a lot of things, especially in the younger age children, if you're looking at milestones or feeding issues, health visitors are a fantastic resource, and I think they are brilliant help to kind of new families and new mums and children up to the age of 5. There's a phone number there, so that you should take down. We will be sending out some of the slide pack with a resource pack as well, so that if you that you will have these details. There's an email address for you to email, and then also there's some resources there. There's a link for you to actually go to and use. This is another really good website, so for new mums, in terms of kind of things to look out for and what to do. And then, of course, there's us. So there is our own Premier Medical Centre. Obviously, there's our phone number, but actually, we now have an app that some of you may have already downloaded. but you can actually book an appointment as a priority by using the app, and actually kind of going through the triage and booking an on-the-day appointment. Usually it's within an hour, and by doing that, you miss the queues, you don't have to wait, and you can take it from there. And there ends the educational session. If possible, what we'll have a look and see if there's any questions. But if possible, if you could use the QR code, just to again fill in a very short survey, and we'll leave this slide up for as long as as we need to, so that we can have a look, and so that we can actually see if this was of use to you and how much you enjoyed it, and hopefully make improvements for the next time that we try this. So I'm just going to look at some of the if there are any kind of Q&As. Tammy, what I might do is obviously working in a hospital now, I think what might be a nice thing is just maybe to touch on COVID as a condition in terms of with children, because I know a lot of people will be concerned about that. Maybe you can touch on kind of COVID in children and you know what you're seeing.
Thanks, Aaron. Yeah. So we are seeing increasing numbers of children with fever in hospitals at the moment, and we know that COVID can affect children and they can catch it, but they're very unlikely to be unwell with it. So most children will just either have no symptoms when they have it or have a slight fever and not be unwell with it. So on the whole, I wouldn't worry at all about your children catching COVID, although it's still important to maintain social distancing and mask wearing as per the government guidelines. The only caveat to that I would advise you that we see, but very, very rarely in some children, is if they've had COVID, and this tends to be in older children, a few months later they can become unwell. And if you notice that your child has a fever for more than 5 days, they're very kind of look unwell, they're very sleepy, and their eyes become quite red, or they might develop a rash on their hands and their feet. That can be associated with COVID, but it is extremely rare, and I really want to emphasize how rare that is. Most children get very few symptoms and are very unlikely to be unwell.
Perfect, thanks, Tammy. Tammy, I'm just gonna we've got about 14 questions, so I'm just going to go through that, if that's okay. And maybe I'll just ask the questions, and if you're okay to answer them, that would be great. So first question is from someone who asks, what are the rules with going to school with these types of rashes?
So that's a great question, and schools and nurseries will often have different rules to some of us, and the answer to all of them is available on different government guidelines. So there's something called the Green Book that anyone can look up that has the answers. But I think specifically most of them you can still go to school. So hand, foot and mouth, often nurseries will say they can't go to school, but the official guideline is that they can go to nursery and school. The only one that they definitely can't go that we've showed you is chickenpox, and you really have to wait until all the lesions have scabbed over before they can go back to school, because it is quite infectious. But the vast majority of the viral rashes, pretty much everything else except for the chickenpox rash, they are allowed to go to school with.
Great, thanks. There's quite a few questions on rashes, which is great. There's one that says, my son did have a skin condition called molluscum contagiosum. Are you okay to talk a little bit about that?
We can, although I'm just going to see if there's any other questions about rashes, and we can try and group them together, because that's...
Oh yeah, perfect. Let me do that. So then we've got molluscum. We've got one on natural remedies for rashes rather than kind of treatment. Should we use coconut oil? And someone's put, should we use coconut oil? I've read that it can cause some allergies. And those I think are, and how can a doctor check rashes with COVID?
Okay, great questions. And I think the most important thing to say about most of these rashes is that we see children with rashes all the time, and they're really very, very common, and the vast majority of the time we'll probably say to you, well, we're not entirely sure what that rash is, but it's probably nothing, and it's dangerous or it's not dangerous, and the majority aren't dangerous. So I think just picking up on a few of the points, so the using coconut, was it coconut butter?
Coconut oil.
Okay, so coconut oil on rashes is completely fine, and a lot of baby dry skin especially, I would say you can use different oils to treat it. Particularly, you can just use regular olive oil or sunflower oil. It's better to avoid using a lot of the seed oils because they can, because of allergies associated with nuts and seeds. So we often say not to use that. And then COVID and rashes, what was it? Can you just repeat the question? Sorry, Aaron.
Yeah, so how can the doctor check rashes with COVID? Or I guess, you know, might be, are there any rashes that you associate with COVID?
So as I mentioned, there's lots of different types of rashes with COVID. And I think the advice with rashes and COVID is that we're learning things all the time. So it's changing day by day. So a few of the things that we've noticed in children are specifically when I mentioned that some children have kind of, we see rashes later on, so a few weeks to a few months after they've had COVID. So particularly we're looking at rashes on the soles of the hands and the feet that might be very peeling. Their eyes might be a bit red. We're also seeing children, particularly older children, with what we call COVID, sometimes called COVID fingers and COVID toes, and these aren't official terms, but you might notice kind of small bloodshot dots in their hands or their fingers or their toes, and they might be a bit painful. So that can be associated with COVID, but less common in children, I think, compared to adults. But yeah, nothing that you wouldn't do anything for it. And then molluscum contagiosum, very quickly. So that is a usually painless rash in children. It looks a bit, I'm just like a little bit like blister-filled dots. You don't do anything about it. It will go away by itself, but it can last for quite some time. But if you're not sure, you can ask your GP and see them.
Yeah, we see lots of molluscum. It's absolutely nothing to worry about. It normally settles usually by a year or 18 months. But it depends, you know, whenever it comes, it will generally go within a year or 18 months. The key thing, I think, is not scratching them and letting them spread. But, you know, it happens very, very commonly and something we see a lot and actually nothing to be concerned about. We've got a question here. How many days of vomiting or a stomach bug until I go to see the doctor? You know, it's a really good question. I would normally say, you know, I would expect that normally a vomiting or stomach bug should settle within 72 hours. Tammy, would you agree that that's kind of a common one for us to think about?
Yeah, I think so. And I think it partly depends on your child's age as well. I think younger children won't be able to cope with as much fluid loss as older children who might be a bit better able to cope and easier to get them to drink. But I'd say, yeah, 48 to 72 hours normally we would expect most tummy bugs to last.
Yeah, fantastic. I've got a question. Well, it's a comment here, but you know, it might be a good one to touch on. It says it's difficult to let them cry when they're ill.
I think crying's probably one of the things I see so commonly in A&E, and I do see a lot of parents and from a lot of friends who have had babies that I think it really pushes you to the edge because you feel like you can't do anything and you can't help your baby and there's nothing you can do with the crying, which is why if they are ill, I would definitely recommend giving a bit of Calpol because it will make them feel better, even if they might not have a very high temperature. Still, if they're unwell and you know they've been in pain, and there's no need for them to kind of suffer in some ways because of it. So if you think a little bit of Calpol will help, then I would advocate for it. It's really difficult. There's no easy solution to a kind of a baby crying except trying your best to soothe them and knowing that it won't last forever.
I think touching on this as well, that someone's written, what do Crisis, which I think is the link that you recommended, what do they do for crying babies?
So Crisis don't necessarily do anything. It's more of a support group that parents with crying babies can contact, and there's quite a lot of support group. There's some really great information online, and we will send it all to you afterwards, from the Institute of Health Visiting, and they have pages of just different organizations you can contact for crying babies. There isn't much that you can do for crying babies. So some babies cry because we think they have either colic or reflux, and some people say that if they are a bit colicky, maybe massaging their tummy helps. But different things work for different babies, and sometimes despite all your best effort, there isn't much you can do. So it's really just knowing that it's a brief period of time in the grand scheme of things, although it can feel like a long time at the time, and just being able to get support. And sometimes I think Crisis really helps in kind of getting parents that have babies that cry a lot together to support each other, because I think sometimes you can compare yourself to other people who might have babies that don't cry as much and think, oh, it's abnormal for my baby to cry, but really it isn't.
Fantastic, thank you. There's a question here. Any nappies, wipes you recommend for nappy rash? Maybe I take this one. I think water wipes are great. We use water wipes very commonly. We buy Pampers for our nappies. I think any high street nappy I think is useful. I haven't tried out lots of different wipes, but the water wipes that we buy are excellent, and I've used them on both my children. Can baby acne happen several times?
I'm not entirely sure is the answer to that. I think probably, I imagine it can, because we don't really know what causes baby acne, but we just know that it's not dangerous. It might be a different type of rash that you're seeing rather than specifically baby acne. It can come and go a little bit in the first few weeks of life. So the distribution might change. So if they're still within the first month or two of life, I wouldn't worry about it. It probably is just baby acne that's kind of moving around the body to different places. So if that's what I mean, yes, once they're bigger, I wouldn't expect it to come and go once they're older than that.
Yeah, and I think I tend to agree. I think in terms of, you might feel that one area of the body is getting better, but another might spring up. So you might initially notice it on the face and then the chest wall. There's another question here about, just as you touched, can you please say if milk spots are common? Very common, 50%. Both my children had it, and it's extremely common. So, it's again, nothing to worry about. It will settle by itself. Just monitor them, and it will go by itself. We've got a couple of questions actually, which are probably great actually. What can I do about my baby's blocked nose when she has a cold?
So that's a great question, and I think we see lots of babies that come to hospital to A&E, especially when they're little, with blocked noses, because it can affect their breathing, and especially when they're really little and all their airways are small and their necks are short and they struggle to breathe a little bit. So what I would say is, if they're very little and babies, you can use some saline nasal drops. So you can just get normal saline, even with a syringe if you have at home, and just drop a few drops into each nostril. Especially helpful either before they're feeding, so it helps clear out their nose before or after, or just before they go to sleep. When they're older, in older children, you can use decongestion nasal sprays, but again, there's nothing really you need to do for it. It's not dangerous. I think children that are older that you notice that are mouth breathing or feel like they have persistently blocked noses, and it might be because they have tissue that sits behind your nose that all of us have, called adenoids, that are very big, or sometimes very big tonsils. Some older children sound like they're blocked all the time, but you can always see your GP for that, and if that's really a problem, they might get referred to an ear, nose and throat doctor. But mostly I would just say saline drops for babies, otherwise don't worry.
Yeah, and just maybe to add that, so blocked nose, no fever, definitely can manage them at home. I've just put in the chat something that as a parent, Tammy, I'm not sure if you know about, but as a parent, we found fantastic. It's something called the nose feeder. So it's a little bit like a suction that goes up the nose, where you can just actually suck out the so it's a device that just goes up the nose and has a little suction tube, and you just suck out a little bit, and if you can get your child to hold their head still, takes out a little bit of gunk from the nose. And my wife and I swear by it. So Tammy, at one point I might give it to you as a present when you eventually get to that point. But it's a great little tool, and I've put the name in the chat. Hopefully I've spelt it incorrectly, but if you do and you Google it, you'll probably be able to do it. Great for kids, great for babies, and really useful. And the next one is the last question that we've got is the local pharmacist good help for me and my child?
If you're happy, I would say definitely yes. Myself and also Professor Blair, who I work with at the hospital, have done quite a lot of projects with pharmacists where they provide over-the-counter treatment for both pregnant women and newborn babies and older children. And we found that actually it works really well. There's never ever more than a 5-minute queue at pharmacists. They're extremely knowledgeable. I have a family full of pharmacists, so I must say that, but they really are knowledgeable, and they can, a lot of the treatment that we would advise you can get over the counter, and your pharmacist is very well equipped to manage it. And if they feel that they're not, then they'll tell you to see your GP.
Yeah, I mean, just to kind of reiterate that and concur, I think a lot of pharmacists these days are being trained in minor ailments and minor illnesses. I think they can be extremely useful, and often, just popping down to see them to buy something over the counter, I think can save you a lot of problems, especially if it's a Saturday. You pop into Boots or your local pharmacist. And around us, there's lots, and I think the key thing is actually, being able to speak to someone rather than, calling the emergency line or anything like that. I think it's really key to use the things that we do and use the things that we have. And I think pharmacists are often underutilized, and I think, there can be a really helpful resource and person for you to speak to for yourself as well as your child. And there we go. Tammy, I think that's the last of our questions. And hopefully everyone has filled in the QR code and zapped the QR code or used the link that we put in to hopefully give us a bit of feedback, kind of after starting the talk as well as kind of ending it. And hopefully I hope you found this extremely useful. Tammy, I just want to say a huge thank you, and maybe just a little word from you in terms of a sign off of kind of key messages that you want to give at the end of this, so that we can hopefully leave this webinar with and hopefully we've left anyone who's attended this as someone who's learned a bit and will take things away.
Thanks, Aaron. Thanks so much for having me. It's been a pleasure, and hopefully people have found it helpful. I suppose my key messages are in terms of, key messages for babies are knowing that all babies cry, that reflux and colic is very normal, and that all your babies will outgrow it, especially once they're weaned. So don't worry too much, even though I know it can be a very tough time. And then I suppose my other key messages just for recognizing unwell children, and these are probably the times I'd advise you that actually you do need to see a doctor, is if your child isn't waking up and not rousable, if they have a fever that lasts for more than 5 days, if they have a rash that, like the meningitis rash that we showed you, when you press it doesn't go away, or if you just think they're really not themselves and you feel anxious about something, then those are the times I'd say see your doctor.
Tammy, thank you very much. It's been, a pleasure working with you, and thank you so much for kind of, joining us on this webinar and producing, the slide set for it. I think hopefully that everyone's really enjoyed it, and hopefully, if you filled in the feedback, we can hopefully we can learn a bit about kind of what might be useful for you when we do further webinars. The webinar has been recorded. I forgot to mention that at the start, but it was mentioned in the chat. So we will be posting this on our website. So it will be available for anyone to have. I've just in the chat put our email address for those that don't have it. We're very happy to send out a resource pack with some of the links that Tammy was talking about. The slides will be available on the website, obviously, but if you wanted the resource pack, which has some kind of useful information for you to use for you and your baby or you and your child, please email us if you've already registered, we're happy to we will send that out. But if you haven't registered and wanted to register, if you wanted the resource pack, please email us at the website and just advise us that you'd like that, and we'd be very happy to send it out. So from me, I'd like to say thank you for attending, and hopefully this has been educational and useful for you. And over to you, Tammy, for the last word to say goodbye.
Thank you so much, Aaron, for having me both at the practice and to do this webinar, and thank you everyone for joining.
All right. Thank you very much. Have a lovely evening, everyone, and stay safe.
Bye.
Bye-bye.